Hey, my name is Brooke Ames. I'm a dually licensed therapist in the state of New Jersey, telehealth therapist in the states of Delaware and Florida. So, dually licensed, that means I'm a licensed clinical social worker and a licensed drug and alcohol counselor. So I have a private practice now that focuses primarily on dual diagnosis because I have both licenses. So dual diagnosis, what does that mean? I love treating people that struggle with mental health issues like anxiety, like depression, attachment issues in their relationships. And then with the addiction license, I also love treating individuals who have suffered from substance use disorders or family members of loved ones who have had substance use disorders. When people say addiction is a family disease, that's so true. It really affects all of our loved ones and all of our relationships when we're someone that suffers from a substance use disorder. So I wanted to come on here and introduce myself. This is my first YouTube video ever. So thank you for being here and thank you for watching. I am not a producer. I am not a director by any means. I'm a therapist at heart, so my videos are not always going to be the best quality. I wanted to come on here and introduce myself though, make more of a presence on the internet in general, and tell you guys a little bit about my story, a little bit about myself. So my name is Brooke Ames. I have a private practice called Gaining Grace. Like I said, we really love treating individuals who struggle with dual diagnosis. Right now, we are telehealth and we offer therapy to individuals, adolescents, and couples in the states of New Jersey, Delaware, and Florida. A little bit about myself, a little bit about how I came about to have a private practice. So I am also in recovery from addiction. I started using substances at the age of 13. For me, it started with my friends, like kind of like experimenting and a little bit of peer pressure. I started using alcohol and marijuana at a young age. And by the age of 17, I was using heroin pretty regularly. So from 17 to 23, I really suffered the consequences of opioid addiction. And what that looked like for me was rehabilitation centers, not being able to hold down a job, flunking out of college, not being able to maintain any relationships, got completely incapable of being a productive member of society or being able to like move forward in any kind of way. I overdosed a ton. It just was like not a pretty sight for me from 17 to 23. At 23, something kind of shifted. I got a moment of clarity. I was really blessed for that. Not everyone receives that, I don't think. And I caught a glimpse of myself in the mirror and I was getting older. I was now in my 20s. I wasn't a teenager anymore and I was not moving towards any goals. I was not doing anything to build a life for myself. And I kind of like realized that in that moment. And I was in the middle of South Florida. I had my own apartment. We didn't have any electricity. It wasn't really like a nice place to live, even though it's a beautiful place to live. And I called my mom and I said, can I please come back? I think I need to make some changes. I think I need to build more of a life for myself. Thankfully, she said yes. I was able to come back to New Jersey. I weaned myself off substances to be able to get onto an airplane. And I was able to board an airplane without any form of ID. And to me, these were all things that were reassuring that like, okay, you're moving in the right direction. I got to New Jersey. I started to become a waitress. I started to be able to hold down a job. I started to be able to make money and save money. Was able to get like my IDs back. I was able to get a license back, get a car, start building again, right? And I went back to school. I got my bachelor's in English. I was able to complete that. I really love to write, so I really love English, and I had difficulty finding a job after that, and so it was go back to school and be a teacher, or go back to school and get a master's degree. And I was like, okay, so at this point in time, maybe my experiences with addiction have served some sort of purpose, and I'm supposed to use those in the future to help others. So maybe that's what I should do, right? I don't know. So I went back and got my master's in social work and also took the courses to be able to become dually licensed in addiction. At this point in time, I started working at substance use facilities. I worked as a house manager at sober living facilities first, and then became a primary therapist, then a program director, then a clinical director at these facilities. graduated with my master's and did all the work to become duly licensed. At this point in time, I also started having a family and got married. I had some difficulty in substance use facilities. I worked as a clinical director for quite some time, and then I was let go after 2.5 years of working at that facility. And I was super bummed about that, and it had me feeling like feelings of rejection and kind of like questioning myself. But I was like, okay, get another job at another substance use facility, be another clinical director. This facility lasted about like 6 weeks. They had like some serious cracks in the system of things, and it wasn't a good fit. I was let go again. But because I was let go again, I was like really questioning myself and feeling really big feelings of rejection, like talking to my husband, like, am I even good at what I'm doing? Like imposter syndrome's coming up. But I had all these people that I supervised, and I had all these past clients, like, no, like, you've helped us a lot, right? So I'm like, okay, maybe this is an opportunity. It feels like rejection, but maybe it's actually an opportunity. I'll open up my private practice. And that's how we originated as Gaining Grace throughout the pandemic. And since then, I've had my private practice, and we've been focusing primarily on, like I said, dual diagnosis. I really love treating individuals who struggle with the anxiety. I love helping women, especially, and even like parents in general, right? Like guys struggle with this too, but there's so many things out there in society that can really trigger that core belief of not feeling good enough. As we wear these hats as wife, as mom, as dads, like an example in our society right now, right, is like if I'm not using a bento box to pack my kids' lunch, then I must not be good enough. And it's like so silly, but like that's really what's happening in our society right now. And a lot of times these core beliefs of not feeling good enough have originated throughout our childhood. We might not even know that they're there. And then these things are happening now in our adult life and in society, and we're like, why are we like feeling like these icky feelings consistently? I'm like feeling like I'm like running on this treadmill to try to keep up, and it's just like not working, and I'm still left not feeling good. I love helping people work through that. I love like tweaking the negative thinking pattern so we can start to feel a little bit better. We can start to influence our quality of life now so that it leans more towards feeling good and the goals in the life that we actually want, right? So this is what I'm doing right now. My name is Brooke Ames. I have about 11 years in recovery from active addiction. My private practice is coming up on 4 years, and the goal is to continue to grow, continue to be a place where individuals, adolescents, and couples can come to work through some of these things and ultimately live a life beyond their wildest dreams, right? That's always the goal, to live with more peace than anxious thoughts. We don't want to be consumed by chaos, whether it's anxious thoughts that are causing the chaos or reality or addiction that's causing the chaos. So I'm going to continue to post videos from here on out. If you're interested in continuing to learn more about mental health tips, click the subscribe button. I will continue to post videos that continue to talk about addiction, anxiety, mental health issues in general, and also like this core belief of not feeling good enough. Also, other social media platforms will continue to post similar content: Instagram, TikTok, Facebook, Pinterest. You can find all of those at Gaining Grace Therapy or Brooke Ames. And as always, if you're interested in learning more about the therapy process, you can email me and schedule a free 10-minute consultation. We can talk more about that too. But thank you guys all for being here. Thank you for continuing to learn a little bit more about me, learn a little bit more about what I do. And I look forward to connecting with you all in the future.